The final battle lines are being drawn over health care reform. Peter Cook is in D.C. with what's likely to survive the final cut. Peter.
Well, Deirdre, one big item that isn't going to make the final cut as the House and Senate prepare to reconcile their competing health care plans is that government-run insurance option, the public option. Top House Democrats on Sunday signaled that fight is largely over, given the opposition in the U.S. Senate.
Not going to rubber stamp the Senate bill. On the other hand, we recognize the realities in the Senate. Look, first let me stress the fact that there are great commonalities between these bills. I mean, about 90% of these bills are the same in terms of prohibiting people from being excluded from insurance coverage based on pre-existing conditions. Both of them reduce the deficit. Both of them cover another 30 million Americans.
But there are also some very big differences, and the lobbying battle isn't taking a break over the holidays. It is continuing today. At the top of the list is how to pay for a final bill. The Senate legislation imposes that 40% excise tax on high-priced or Cadillac health care plans. The president likes that approach because he thinks it will ultimately help bring down overall health care costs. But insurers don't like it. Neither do labor unions. When you get those two groups opposed, that's a significant force. They favor the House proposal to impose a 5.4% surtax on individuals making $500,000 a year or couples earning more than $1 million a year. Lobbyists and some lawmakers say a hybrid approach is the most likely result. Another big-ticket item, every American business is following the penalties that are going to be imposed on employers for not covering their workers. The House language is tougher here. Every company out there, every industry wants a carve-out led, first of all, by some in the construction business. It all means that the $600 million spent on lobbying through September of this year could start to push $1 billion into 2010. So this lobbying fight not over by a long shot.
Peter,
John?
what about the drug makers?
And Deirdre, after dodging several bullets during the course of the debate, drug makers also have several fights on their hand. They want to, first of all, cap the amount they have to spend to help seniors pay for their medicines at $80 billion. That was the deal they worked out with the White House months ago. They also want to remove a House provision that would allow the government to use its buying power to negotiate drug prices directly with manufacturers. They've long opposed that. They also want to make sure that the $2.3 billion in annual fees that they have to pay in this Senate bill, that figure doesn't increase and perhaps maybe even comes down. They're also want to make sure that there's no new effort to allow reimportation from Canada, other countries. Deirdre, they won that fight on the floor in the U.S. Senate resoundingly, and they think that's done for good, but they're going to keep an eye on that as well.